There we go. We'll be recording today's conversation and we'll send out notes. So if you have to jump off at any point, or if you know somebody who needs this information, you'll be able to share that. So at Johnson County Public Health, we've been focused for months on leading the community through this pandemic with a specific focus on equity. But as we move to the vaccination portion of the pandemic, we recognize that there are segments of our community who, for lots and lots of reasons, will experience greater barriers to accessing the vaccine than others. Everything from past trauma associated with vaccine and medical research, to language barriers, to transportation barriers. And we want to do everything that we can to ensure equitable access. Which brings us to this conversation. And we recognize that many conversations are already happening. So we're hoping to try to learn from what you're already doing and begin thinking, if you haven't yet, about ways that we can do this work. So really, here at the health department, ideally, we want everyone to get the vaccine, but at the very least, we don't want the reason that somebody doesn't to be because they didn't know it was available, or they didn't know they were eligible, or the information wasn't in a language that they spoke, or they didn't know it was safe because they didn't hear that message from somebody that they trust. Is anybody else impressed with my ability to just keep going while letting people in? I love it. This is a big meeting, and I'm so glad so many people are joining. So, all right, the folks on this call are in the thick of it in your communities, and some of you are already doing this work. Others might be just getting started, and so we're going to try to get on the same page today. We know that you all play an integral role. So as the health department, we know that we have a lot that we can learn from you, and we want to partner with you. So you all play an integral role in ensuring that really good, solid, credible information gets out to the individuals in the community. You're likely that trusted messenger that they need to hear from. And you also play an integral role in helping facilitate shared learning. So you can help us understand what the community really needs. Current beliefs and barriers in the communities that you're serving, what will get in the way of them getting the vaccine, feeling safe and confident in doing so. So we'll talk more about those things later in the call, but this is the first of many touch bases to open those lines of communication so that we can hear from you, can learn from you about what you're learning in the communities, and that can help inform the vaccine process. This conversation is not about vaccine allocation specifically. Those things are regulated at the state level, and we're kind of following the rules that have been handed down. But what we're talking about is, how do we get that information out? How do we make sure that the community knows about it, understands it, somebody that they can ask questions of, that kind of thing. So we're going to talk about ways that you're already doing that, what we can learn, and then how we can support each other going forward. So let me, today in this call, we're going to talk about what's happening with the vaccine right now. So Susan Villada will give us a vaccine update, and then we're going to discuss equity concerns that you're already seeing and questions that we'd like you to start thinking about if you haven't. We'll discuss concerns and ideas and how we support the work that you're doing, and then we'll talk about next steps. A few housekeeping things. I've already mentioned that we'll record it and we'll send out notes and the recording after this call with some additional information. And then we also know that some of you might get pulled away to an overlapping 1 p.m. meeting where Sam Jarvis, our community health manager, will be giving information to the community related to the vaccine. So if you need to jump off, we'll be sending notes after. I'm going to pass it over to Susan now to give an update on COVID-19 and the vaccine.
Great. Thank you, Kate. So I was peeking through at everybody's names and faces, and I see a lot of familiar ones that I've worked with for years. So, hey, glad you're here. And a lot of new faces too. So we're happy so many folks are here. So what do we know, right? What do we know already? So we know that the infection, right, SARS-CoV-2, the virus that causes COVID-19, can result in a range of illnesses for folks. Some folks have really mild illness, and unfortunately, some folks have very severe illness and even die with this virus. So This time we know about 30% of people infected with it do not have any symptoms. So again, we keep learning more and more about that, but that's what that number is about at right now. Unfortunately, we can't predict how severe anyone's illness might be, but we do know that some things increase your risk. So those that are older and those people that have certain medical conditions, namely diabetes, obesity, cancer, heart disease, among some others, but those are kind of the ones that hit the top there that stand out. And I know you guys have seen millions of lists like these, right? How do we prevent COVID-19? You're doing it. I see you in the community wearing your masks. I see you being good leaders for everybody else to practice social distancing. We know you know these things, but we have to keep repeating them. So even that simple hand washing, it's really, really important. All right, on to the vaccines here a little bit. So COVID-19 vaccinations are definitely a safer way to help build protection. Getting the virus that causes COVID-19 may offer some natural protection, right? We know that, known as immunity. But experts don't know how long this protection lasts, unfortunately. And so the risk of severe illness and death from COVID-19 far outweighs any benefits of the natural immunity. So COVID-19 vaccination will help protect you. Key facts. It's easy to get confused by all this information that's circulating, some of which might even be conflicting, right? We've seen that, I've seen that. These vaccinations will keep folks from getting COVID-19. Getting the vaccine will help create that immune response, your body basically having some ability to fight that virus without you having to actually get the virus in the first place, right? And experience that illness. So based on what we know about vaccines for other diseases, experts believe that getting the COVID-19 vaccine may help you, like I said, from getting it at all, but definitely help you from getting seriously ill, even if you do happen to still get COVID-19. Okay, safety. Everybody asks about this, right? I understand your concern. Knowledge is power. The amount of new information that we've all had to try to absorb and interpret and communicate with friends and family is overwhelming, to say the least. Everyone has questions about the vaccines, and that's no surprise. As someone who's worked in public health for 12 years, I get it, but I suggest you get answers from scientists and trusted sources. Please look to us if you have a question that you're not finding an answer for elsewhere. If you're looking at the Iowa Department of Public Health or CDC, or talk to healthcare providers to help you make that decision. It is a decision for you to make, and there's a lot of misinformation out there. So they have proven what's on the market so far to be effective and safe among many different groups. Okay, so that's groups defined by race, by age, ethnicity, obesity, and even presence of other types of diseases. So even though these vaccines were developed rather quickly, we know they were, there's no hiding that, they still had to go through the exact same process, the rigorous safety standards as any other vaccine has. No standards, no steps were skipped. I'm sure a lot of you have heard the term mRNA by now. I've watched a lot of videos. I'm not sure that I still understand exactly how it works. I keep watching them. I keep trying to learn more as well. I'm certainly no vaccine expert, but scientists have been studying and working with coronaviruses and mRNA for decades. That part's not new. So I knew when I learned that, and a lot of my friends and family learned that, that was kind of a switch for them. So that also helps speed up that process, is that studying for those, for mRNA and for coronaviruses, had been going on for a lot of years. So it's not brand new information. If you've seen this, be safe, heard of it, I just want you to get kind of the image and the phrase be safe in your head. This information will be for CDC to keep collecting information. So what it does, it's smartphone based, but it's a web tool as well. So there's text and web built in. So again, not everybody can use it. I understand that, but it's a personalized health check-in after you've been vaccinated. So it's going to help the CDC monitor safety while it watches as so many more people get the vaccine. So I just wanted you to have heard about Be Safe, and you can ask questions about it another time as well. So what to expect before, during, and after. So before vaccine, just like we're talking about here, get some questions answered, and we're going to have a little time here for kind of an open Q&A on it. And then when you go get your vaccine, there'll be information for you there, and you can talk to the provider that's giving it as well if you still have questions. You'll get a little card to kind of help you track that process. And then after, as we talked about, using that Be Safe tool, that would be great. And while I'd love to tell you that we can get rid of all the masks, it won't be time yet. It won't be time for big parties and hugging and kissing up all your family and friends. We still have to continue to do a lot of those things that keep us safe for some time, okay? And I know people are sick of hearing that, but it's just the truth. Cost, a lot of people have asked about it. It's not a concern. It should not be a concern. Everybody that wants this vaccine should be able to get it. Will they maybe charge your healthcare an administration fee if you have healthcare coverage? Yes. But no one can be denied on their ability to pay, not pay that administration fee. And immigration status is not something that is required or asked. Everyone can be vaccinated if they choose to get vaccinated. Okay, what's going on here, right? Well, Susan, where do I go? How do I sign up, right? If I hear that question one more time, I think my head's going to pop off, but I understand why people are asking it, and they're asking it around the country. So the who, the how, and the where. So I'm going to tell you, and please just ask if it's not clear. You may have seen this graph sort of circulating. This is something that the state created. We added to it a little bit, but this is kind of how all this is starting. Whoops. So phase 1B, that's where we're at in the phases right now, right? So everybody 65 and older is eligible. Does that mean everybody 65 and older can get the vaccine this week? Unfortunately not. But they're open this whole time of phase 1B. So as you see all those tiers, we're going to be vaccinating those 65 and older this whole time. I know that's been a little bit of a confusing point. So the idea is that we go through each tier one at a time. So we're starting with tier 1. So that would be your firefighters, your police, child welfare workers, childcare workers, and preschool through 12th grade school staff. So, and then tier 2, tier 3, I mean, we can talk about these, but I'd rather talk with you all about a lot of things. So you can look this up, or we can get it out to you as well. But that's how those tiers are supposed to work, kind of down as that graph flows, I guess, how I should say it. So if you know of somebody that's 65 and older and they're a Johnson County resident, and they have a University of Iowa or Mercy Iowa City healthcare provider right now, they have already started last week contacting eligible patients. Susan, what does eligible patients mean? It means somebody that they've served in the last 2 years directly right now. So they're going to reach out to those folks. As supply increases, we'll have more places to go, and more people will be able to be vaccinated. And actually, we're finding out, I think still today, I saw an email before this started, and so I didn't get to confirm it, but we'll have other options here shortly, any minute. If you haven't been seen by UHC or Mercy, you're not being forgotten. This was a starting point. We had to start somewhere, all right? What else you need to understand is 50% of this vaccine right now needs to go to 65 and older, and the other 50% needs to go to those tiers listed on the graph. So right now, teachers, childcare workers, first responders. So if you're not contacted in these first few weeks and you're over 65, please know that even if you get this vaccine in the next few coming weeks and even into March, you're still at the front of the line. It's just impossible to line you all up and vaccinate you all at the same time. And if we had more, we would figure that out, trust me. Okay, so that's 65 plus. So this is the other folks I've been talking about. For those that qualify because of their occupation, because of their work, what they do in our community, we at Johnson County Public Health are working directly with leadership at these organizations. So if you do one of these jobs, talk to them, talk to your employer. They're going to have talked to one of my coworkers, I guarantee you, and they have a plan set up to work with you. If you haven't already seen it, I got to put in my shameless plug for Vaccine Watch Wednesday. If you're sick of seeing my face, I'll try to have more guests in. And we try to put new information out each week, and then any pressing information. So that's on our website. A good place to go, Johnson County, Iowa, our main website. On the bottom of the page, there's a big red button that says COVID-19 information. That will get you anything that you need to know here. And we're also emailing it to a lot of you, and I hope that you're sharing it. I see that you are. I'm just so hopeful. I can't communicate this to the public. Our small team here for communications, we need your help getting out accurate information, and we do want to learn from you. So I'm glad that you're all here.
All right, thank you, Susan. Before we move to this next spot, Susan, if you want to go back one, any questions right now for Susan or the team about vaccine availability, that kind of thing, the things that she talked through? I know there's a lot of you, but feel free to come off mute, or you can put something in the chat if that's easier for you.
Well, Becky Reedus with Community Crisis Intervention Services. I can't go back from this today without asking this question. My employees want to know. So I believe I'm just going to use two of our services, Mobile Crisis and the food pantries. Particularly the food pantries, we can't self-isolate. We can protect ourselves as much as possible, and we've done that. I believe that those employees are in that first tier. I have not been contacted yet. And the mobile crisis program, we can't lift ourselves from telehealth services until we can get some vaccinations for employees, and I haven't been contacted about that yet either. Although essential food, I imagine that's grocery store workers and things like that. They may be on the list. I'm interpreting it as that. My food pantry is not on the list. It should be. Counselor settings that go out to vulnerable populations, I haven't been contacted. I'm asking the question. I realize I don't want to make your head explode, Susan. I'm sorry about that.
No,
but,
Becky, I'm so glad you asked. So what
okay.
I'm going to do, I'm going to have somebody from our planning team reach out to you and go over a set of questions.
Okay.
To kind of determine your eligibility.
Okay.
It's tricky. That food, agriculture, distribution, and manufacturing one is really, the way they've defined it is for big spaces, baking, manufacturing the food, putting it together, those kinds of things. There's a lot of ins and outs. So, but I, in terms of being a first responder, there's some of those things that you do that I certainly think we need to talk with you about. So, this is great. We'll make sure someone reaches out to you.
I also have to say that there are probably some other, my other fellow nonprofits who are in the same boat. So I've been trying to be good and not contact anybody and wait to be called, but my employees are pressuring me, and so
you're doing the right thing. This is a perfect time to ask.
Good. Okay. Thanks so much, Susan. I appreciate it.
Thank you for that, Becky. And I would just say, really what is difficult for our team is when, Becky, for instance, if all of your staff were to contact us, but you taking those questions and then reaching out is perfect. And we're doing our best to make sure that we've got everybody on our list. But if you think that you qualify within a particular category and you haven't heard, and get the word out that your staff shouldn't contact us, but we do have people here who want to partner with you and figure that out, as Susan said.
Great. I so appreciate that response. Thank you. And I know it's been difficult, and I know you can't get to everybody, but I appreciate you taking my question. Thank you.
Well, we certainly appreciate that approach and your patience. So thank you for that. Any other questions from the group before we move to additional stuff?
Hi, this is Sandy with Goodwill of the Heartland. And I think I would just second what Becky was saying, because we haven't been contacted. A lot of the clients that we work with have been vaccinated through their group home settings. And so I have been getting a lot of questions because we all work with the same populations as far as if I have, any information on where we might fall in being able to be vaccinated. So thank you.
Thank you. All right, so if you've got questions like Sandy and Becky posed, please reach out to us. We'll talk you through it as Susan referenced. We've got a very specific criteria that we'll take you through to figure out whether you qualify. All right, so Susan, you want to go to the next slide? Before we move to an open discussion with all of you about what you're hearing from your communities, I want to talk about some support that we'll have available. And we're talking about this now in the conversation so that you can be thinking as we start talking about ways that we could reach the community, you can think about the fact that there might be some support available. So we've been provided through IDPH's immunization department some additional funding. We've got $10,000 available that we would like to pass through to you all or other folks who are in positions like you to increase vaccine confidence in vulnerable communities. So this could be for any engagement or assessment activities that you may have planned or may think of, communication efforts, translation, anything that you can think of that would be really useful and effective in trying to help your communities get information about the vaccine, help us learn from your communities, that kind of thing. We're going to split the funding into two buckets so that you don't feel pressure now to have an idea. If you think of something over the next 5 months or so, there will be some funding preserved for that second half, but it is just kind of first come, first serve. We'll break it up into funding levels so that if you're just looking for something simple, maybe you're looking for food for a focus group that you want to, this would be assuming that we can do this outside, maybe this is a few months from now, but that kind of thing, maybe that's a 251. But if you've got an idea that's maybe larger or takes some additional funding, but you think will really reach the vulnerable community or get good information to them or what have you, maybe you go for the 750. And then the other thing we just wanted to mention here is that if you've got an idea and it really will cost more than this, but it reaches a large population or it reaches more than one vulnerable group or what have you, just get that feedback to us. We're kind of taking a stab in the dark at what will be needed, but we really want to learn from you all. So Susan, will you go to the next slide? Just a couple simple requirements. There'll be an application, and I use the word application a little loosely because it'll be a pretty simple form. We don't want to put up a ton of barriers for you to access this funding, but we do need to know what you're thinking, who it will be for. It needs to be focused on a vulnerable Johnson County community. We'd like to know what you hope to get out of it and what your budget will be. And then we'll just ask that you get us a report after the fact to tell us how it went. We want to know about the things that worked, and we want to have record of those things. So more information to come on this. We will distribute the details, the application. You can kind of put it in your back pocket and think about it, and you can get it out to anyone else who would be interested. All right, so we're going to move next to discussion. So Catherine Edel will be taking over at this point and facilitating some discussion.
Yeah, hi everybody. Thank you so much for being here. My name is Catherine Edel and I'm a health educator here with Johnson County Public Health. So now at this point in this meeting, we want to hear from you all. And to do that, we're going to use a system, it's called Mentimeter. And Hannah Tice, who I'll also let introduce, put the link to that platform in our chat. So you can go ahead and click on that link and then plug in that code. And that should get you to where we want you. Hannah, before we jump in, do you want to go ahead and introduce yourself?
Yeah, hi everyone. I'm Hannah. I'm part of the CDC Public Health Associate Program, and I was stationed here in Johnson County and I'll just be doing the tech side of this Mentimeter. But yeah, if you go to menti.com and input the code 2972025 or click on the link I put in the chat, you should be able to access it.
And I will give it a minute before we go ahead and jump in. And please, if any of you all want to vocalize any comments, questions, concerns throughout this time, please feel free to unmute yourself and chime in. And by all means, always feel free to write anything into the chat box. Again, this is all being recorded, so we will have great documentation. For the first question, are people in your community in Johnson County unsure about getting the COVID-19 vaccine? Sure. So that's a really good point. We should have included an unsure option, and I will make a note of that. All right, let's go ahead and move to the next question. So where do you look for the latest COVID-19 information? And then I would think about extending that. So not only you, but the communities who you interact with. What are you hearing from them in terms of where they collect information? CDC, all good, very good resources. Social media. Times. So that's good. CDC is getting bigger. So we from a public health standpoint, we love to see that. Social media can certainly be tricky in terms of getting accurate information, but as human beings, we're social creatures and we're always interested in knowing kind of what the thoughts and opinions of people who we interact with are. So thank you. Let's go ahead and move to the next question, Hannah. So what's already being done in your community to get accurate information about COVID-19 vaccines to everyone?
As people are answering that, I might just make a comment. Mark Nolte in the chat just mentioned, or excuse me, it was Claudia right after that, that most might be looking to CDC on this call. And that's actually a fair point. We also want you to be thinking about where your communities might be getting information and how we can make sure that through those channels, good, solid information is getting out. So great point.
Yeah. Thank you for helping me watch the chat, Kate. Wonderful.
For those of you that like to be vocal, you can certainly speak up and answer these questions aloud as well.
I just have one point. I already wrote it out there, but a lot of our community, actually, we've gotten a lot of questions from people who primarily do not speak English, and they don't know where to turn. And so we're lucky in our particular establishment that we have volunteers and staff members that speak different languages and are able to relay information. But a lot of the stuff that we're getting from you guys and other sources is primarily in English, and we are getting a lot of questions from the other language speakers. And so that's something that is always a little stressful to us because we want to make sure that we're giving the most correct, up-to-date information. But it only is happening when our staff or volunteers are having individual conversations with these members as they're either picking up curbside or using our drive-through services or on our phone. And so we would really like to see something that we could spread more to the community at large through things like our social media.
I've got a recent press release coming in 5 different languages, hopefully by the end of today, finally. And I'd like to get some of those shorter things. I agree, because I think those are easier to share. Are you already on my email list for?
Yeah,
okay,
I am.
So that's how I'll be sending that out today. Okay, good. And
Awesome.
that's a very fair. We've had some struggles figuring out some translation services. So
for sure. And feel free to reach out to us if you need any translation help. We're lucky to have a lot of community members who speak 5 or 6 different languages. So
sorry, I can't see who just made that comment. What is your name and what organization are you with?
my name's Paula, and I'm the programs coordinator and the communications coordinator at the Coralville Community Food Pantry.
Wonderful. Thank you so much.
Hala, thank you for bringing that to our attention. And I think that that's one of the things that we could potentially use this ongoing group for as well, is to share resources. If there's one group that has translated something into a particular language or made it culturally appropriate for a particular group, we could share those resources across this group as well. So thank you for that.
Thank you for all of the comments. These are extremely helpful.
Hi, everyone. My name is Marlene Mendoza. I'm president of the League of United Latin American Citizens here in Iowa City. I just got in a little bit late, so I'm sorry if you already answered this question, but I believe I just heard Paola mention something about resources in different languages. And I just kind of wanted to build off that comment and say that I'm not sure if the communication methods to spread the information is going to look differently for different communities, but LULAC at least has a lot of media partners in Spanish regarding online magazines, newspapers. And so if there's a space to have a conversation on how to spread the information in a more cultural approach, we're happy to partner and have those conversations. For example, at least in the Latino community, a lot of people listen to radio. And so if we can have different messages, again, it could be a person from the Johnson County Public Health Department with a translator to just have like a conversation on the radio with someone, or it could be, just like different just approaches that we can discuss. I think that would be the best way to get the information instead of, for example, just printing flyers, because at least in our community, it's more based on like conversations where people feel like they can have their questions answered as well, because there is a lot of skepticism around the vaccine, at least that I have seen just from people reaching out and asking different questions about the, is there enough for the second dose, where the difference between the vaccines, et cetera.
Thank you so much for that comment. And would you mind repeating your name and the organization that you work for?
Of course. My name is Marlene Mendoza, M-A-R-L-E-N. Last name is Mendoza, M-E-N-D-O-C-A. And I'm president of League of United Latin American Citizens, or LULAC, for Iowa City. That's Council 308. However, I also sit as the chair of the state civic engagement at the state level for LULAC. There are 30, I believe there's 34 councils across the state of Iowa, but obviously for Johnson County, we're happy to collaborate with other councils as well, just so that we can streamline a lot of this information. Our LULAC email is lulac308@gmail.com. I can put it in the chat as well.
I've got it.
Wonderful, thank you.
Yeah. Awesome. And we'd be happy to be on the radio. Let's set something up. I'll email you.
Oh, that would be perfect. Thank you.
Is there anybody else who would like to comment? Otherwise, we'll look to move to the next question. right, Hannah, let's go ahead and jump forward.
Sorry, it wasn't letting me unmute. This is the next question. People have started answering.
Oh my gosh, wonderful. Yeah. So how do I get it? Is it safe? How will it affect my fertility? Where do I sign up? These are all questions that are certainly reoccurring that have been coming through our COVID-19 phone bank system. So this information is certainly aligning with the information that we've already collected. Will I be sterilized from the vaccine? Access, safety. Do I have to pay? Which, Susan, were you going to touch on that? About in terms of payment? Or
Yeah, it was in there.
oh, it was. I'm so sorry. I have yet to eat lunch today, so I must have missed that.
That's right. But I mean, people are still getting these questions just because, you know, we said that today. This is a good indicator of what they're hearing overall. So that's fine.
Mm-hmm. Please, again, if you would like to vocalize anything about your specific community or about you individually, please unmute yourself.
Hey, Catherine, this is Eugenia from Heritage.
Yeah.
I guess one question I keep thinking of is, do you have any idea how the new administration might be either assisting more with helping getting information out, or has they given you any kind of timeline or anything? Just have been curious about that.
Not that I'm aware of. Susan or Kate might have more information on that. As far as I'm aware, the Biden administration is looking to increase the amount of vaccine that is going to be distributed to states, and therefore the amount of vaccine that we can, look to anticipate in Johnson County. Do you have anything more to add on that, Susan or Kate?
I wish I did. Time will tell. We're not what you're reading in any media and any trustworthy media sources is what we know, Eugenia. I wish we had some inside scoop, but we don't.
Well, and that's perfectly fine. I mean, that's kind of what I expected, but like Heritage, serves 7 counties, and with each county doing it just a little bit different, we're, trying to keep up to date on everything and certainly get that information out the best way we can. So I think folks are working hopefully at that state level that are trying to get things a little streamlined for us all. But
yeah, it's so confusing when every county could be doing something a little bit differently. It's nice because we can focus on what might work best in our community, but it creates a lot of confusion.
All right, we do have 4 more questions to get through, and we definitely don't want to keep you all over. So let's go ahead and jump to the next question. And when we're done with this, I'll put my email in the chat. And if any of you all want to put forth, more of an extended reply, please feel free to email me directly and I'll pass the information on. So in your opinion, what is needed in your community for people to feel comfortable getting the COVID-19 vaccine? Yep. Mhm. So a lot to do with communication and how messaging is being delivered, which is totally understandable. Are we jumping to the next question, Hannah? Oh, there we go.
Sorry, I clicked the button a little too
No,
early.
it's okay. It's all right. Vaccine locations in all neighborhoods. I know from a distribution standpoint, that's been very tricky just in terms of quality assurance practices, having to do with how vaccines are handled. Native languages. So in terms, I'm seeing a lot of, if leaders of our specific community were to get vaccinated and make a public statement, then that would be very well received. And that's something that's happening on a national scale as well. How do you think that those messages should be delivered? Through social media, newspaper, short video? If you have any thoughts about how messaging should be delivered, please let us know.
How many questions do you have left, Catherine? Is it two
I
more?
think just a few.
And we've
Yeah,
got
I think
15
there's
minutes.
2 more. The next one is just a very open-ended.
I want to jump in, and the rest of the team is probably going to strangle me for this, but this is just how I roll. I see so many of you saying, the how are people getting this and the communication of it. And I only briefly touched on it in this presentation, and we're trying to email over 300 community partners, coalitions, and put it on our social media and put it in press releases. Does somebody that's listening right now have a better way to say this how right now, other than UIHC and Mercy will be contacting some select sort of random folks here at the beginning, and that's just a start. And again, I hope today I'm going to be able to say something more about how folks that don't have a provider there can access this. But the real difference is that people aren't frantic. What I'd like to say is, how you want concert tickets and you keep refreshing a website or you keep calling the number back in the day? That we don't want people to be in that frantic state. Maybe some people prefer that, I don't know, or waiting in long lines to get the vaccine. So we're trying to do the, hang on and be patient and we'll get to you without being frantic. But I don't think that's coming across well. And I'm responsible for a lot of that. So please throw it out there. If we've got 2 minutes here, since we only have 2 questions left, I think people put some things in the chat.
Yeah, that was me and Jessica, Susan, it's Paola again, but we were talking about finding trustworthy places around the community. I'm sure this is being already looked at and is already in your guys' plans. But setting up at locations, we did a flu vaccine here with the mobile clinic, and we had 30 families say like, yes, we want the flu vaccine. They showed up. And so I think maybe finding particular physical locations where I'm not sure if Johnson County Public Health has the staff or the ability to get people here to answer questions and see a face and know who they're talking to. As much as we love social media and as much as we love answering questions, I think seeing a trustworthy person on the other end of the mask and saying, okay, this person knows, or having translators and just putting a face to the name, I think is really helpful. And obviously I know long-term you guys are looking at setting up community places, but
Yes.
just keeping people in the loop and having a face to the name, I think is so helpful, because that creates that community trust that we obviously can't make through social media or through printed press.
You tell me where and when to show up. 3
All right.
a.m.
I'll shoot you an email. I got
Anywhere
you.
in the county. I'm serious. Any of us would be happy. I think that's a great idea to be at those venues. We just need to know they're happening and that people come, and we're happy to sit there and chat with folks. Absolutely. And if somebody can translate for us in other languages, that's awesome. Great idea.
Yeah, absolutely. Awesome. Thank you so much, Susan. I'll shoot you an email with some more details.
Susan, this is Sandy with Goodwill again. Can you kind of explain how the national pharmacies fall into this? I mean, at what point would somebody be able to go to like Walgreens, or which so many individuals seem to do with the flu shots, go to their local pharmacy?
Good question. And I promise I won't hijack this, you guys. I'm only going to take about one more minute and we'll get right back here because they have a great lineup. So the federal partnership with Walgreens and CVS was dealing with long-term care and assisted living for the most part. But you're right, Sandy. I do think in the coming months, we'll see them be able to vaccinate more of the public. We don't know in terms of the federal plans what they might allocate or what might come out that way. That's not part of what we get to decide right now. But we do have local pharmacy partners as well, and plenty listed and ready to go. The problem isn't people to give this vaccine anywhere, even in a mobile way or any other. That's not the problem at all. We just need more vaccine.
Sure. I was just thinking so many people are so comfortable with that, that structure for getting
Agreed.
vaccinations.
Yes, we are still using Peach Jar. Come hang out at the community pantry. I hope this would be so great. I'm sick of this office. I mean, I don't want to spread any COVID, but if I can distance and wear my mask, I'm happy to, or other folks here can too as well. Churches, yes, religious leaders are on our list of people getting the information. So if you're hearing your church isn't at the table because, you know, we did a search or we have people suggesting, throw those emails in the chat. I just wanted to try to get, trust is broken. Totally get that. With research institutions and with public health, science and healthcare, we know we have hard work in front of us. Okay, schools. Yes, we have partnered with schools big time. And when we know about wider community vaccination efforts, it will go that direction. I'm so glad I captured this real quick and I'm so sorry I hijacked. But we have a lot of smart people on this call and I want to take advantage of you all.
Thank you all for the comments. Susan just was reading a few of them. Just know that we'll be looking at all comments within Mentimeter and within the chat box. This is exactly why we had this conversation, and we don't want you to feel that you've asked the question or given us this piece of information and it'll never get used or looped back. Ariana brought up the great question of how can she or you all assist with gaining trust back, and that's exactly what we're hoping to partner to do. We know that in a lot of ways we'll need your help in bridging that gap and getting good information and helping us increase and build vaccine confidence in communities. So we hope to be able to continue that conversation and utilize the great relationships built in the community.
And I went ahead and put my email address in the chat. So if any of you want to message me privately, I will be sure to share any thoughts, concerns, opinions with the larger group.
Thank you, Catherine. And we will make sure that when we send out the notes from this meeting, we'll do our best to maybe capture some themes, but then also if that takes a little bit of time because there's a lot of information, we'll make sure that all of that gets to you and you'll have our contact information and a way to continue the conversation as we go.
So just looking at the time, should we move into next steps?
That would be great.
Great.
We've just got one final slide for that, so I can share, Susan, unless you want to do that. Do you have it up still?
Did we want to do this question first?
No, we'll do that right after we talk about next steps. Thank you, Hannah. Thanks for everybody's patience and us going back and forth a bit. I'm not going to bother with presenting this. I'm just going to, you can see the slide here. We just want to talk through the next steps, knowing that this is the start of more. So first, we will make sure that you all get the mini grant application, meeting notes, recording, contact information. We'll make sure all of that gets out to you. And then we'd like to talk about a recurring all agency Zoom meeting. So one of the distinctions that we made at the beginning of this call, and I'll just make it again for anybody who came late, is that we know that we're not talking today directly with the community. We know that you all are leaders in the community or working, representing in one way or another. And we know those conversations have to happen, and we're hoping and we know that you're doing some of them and we'll begin to do some of them, and we're here to support in any way we can. But as those are happening, we think it'd be really effective to continue to meet at this level to talk about what we're learning and what we can do. So we'd like to talk about a recurring Zoom call like this to continue that conversation. And we'll do a little Mentimeter to find out kind of the timing that works well for you all. But in that call, we can make sure that you have the latest up-to-date COVID vaccine information. You'll have an opportunity to ask questions. You can bring needs that you're seeing in the community, like what you did, but additional things that you're learning. We can brainstorm, and you can help inform the vaccine planning process. Knowing, of course, that some decisions are out of our hands, but we want to know to the best of our ability what's happening in the community so that we can do everything that we can. The other comment that we just wanted to make is that if you have a coalition, if you lead a coalition, or you work with the community and you have something active that you'd like us to be at, to engage with, to bring information, etc., please let us know. We would love, and I think Susan's enthusiasm has shown that we would love to come to you as well. All right. So I'm going to stop sharing. Hannah, do you want to do the next poll? Looks like it's kind of neck and neck. One of the things that we've discussed internally is that we are very much in a hurry up and wait kind of situation, and have been throughout this pandemic. So we get new information that we have to implement within a couple days, and then we wait for some time before we're able to move forward. And so we can always adjust the timing of our meeting as we move toward a more community-based vaccine administration. So we're months away from the average Joe being able to get a vaccine. And so we have a little bit of time, and yet our 65 and olders are able to get it now. And we recognize that there are lots of vulnerable folks in that community as well. So there's a lot happening, but for some of you, your particular communities might not be eligible yet, and you might have a little bit more time. So we can always start with something like twice a month. And if that's too often, go to once a month, and we'll just be flexible as we go. All right.
I just want to mention one of the comments in the chat that Claudia Curran put that twice per month would allow people to join at their leisure if they couldn't make one twice. So I think that's a really good point about having it twice a month just to make sure we can get the most people.
Yeah, great point. Thank you. All right. I believe this is the last. We don't have a Mentimeter for time and day and that kind of thing. We'll talk about what might work. We might send a doodle poll, but we'll try to just do something recurring, knowing that it's not going to work for everyone, but that we will share meeting notes after each meeting, and we'll try to record it as we're doing with this. We've only got a couple minutes left. We appreciate so much all of you taking the time, the energy. We know that there are lots of questions and frankly, probably a lot of frustrations. And so we just appreciate you partnering with us throughout. Is there any final questions or comments right now that you think is important for us to know? Okay. Well, if you think of anything, you know where to find us. And we will continue to meet. So thank you all for taking the time. Have a wonderful rest of your Monday, and then we'll be in touch with all the information from this. Thank you all.
We appreciate you. Take care.